All right. So this is our final video lecture for the week. Hopefully, you've already watched the promoting healthy fetal development, promoting a healthy pregnancy, and also the fetal development video lectures. But now we're going to talk about labor and delivery. And I do want to say, don't worry, there's nothing that you need to be too squeamish about in this, but there are options that you can watch some birth videos and things if you want to go to the slides. I do believe it's the very last slide. I do have a link to a delivery video if that's something you would like to watch. I do encourage everyone to have seen at least one labor or delivery video in their lifetime if they haven't already. All right. So um, now we've talked about the development of the fetus. They are at week 38. They are ready to be born. So the infant sits lower in the abdomen. That happens, like we talked about in the last video, about 2 weeks prior to birth. And the mother may be occasionally having these mild contractions called Braxton Hicks. They will, as she gets further and closer to birth, they will become stronger and more regular. There is a mucus plug that plugs up the cervix, and that will become dislodged. And that's because the cervix is widening, getting ready for birth. So that's one sign that a mother knows it's coming. It might not be today, but it's coming soon, right? Labor is coming soon. And then leaking of the amniotic fluid, so that she may slowly start to experience that leak, or it may completely bust and it would be a much larger leak. When you get to the point where we are leaking the amniotic fluid, definitely want to contact the doctor. And even with mild contractions, you may want to seek the doctor, especially if they're coming close together, so 5 minutes or less together, because you may think they're Braxton Hicks, but they may be actual contractions. So those are things to think about at the beginning stages of labor. So, when we talk about the birthing process, it really comes in three stages. The first stage is the longest stage, and this can last 14 to 17 hours. It varies depending on women. But for a first time mother, it's going to be longer. And then typically for subsequent births, it will be shorter, maybe 6 to 8 hours. And what happens during this time is they're just continually having contractions. It's causing the cervix to dilate and get large enough for the baby to pass through, is what's happening during this time. In the second stage, this is when the birthing process is actually going to happen. So this can last anywhere from 30 to 90 minutes. This is when the cervix becomes completely dilated, the contractions get more painful, and the infant is born through the mother pushing them out. If the mother cannot push them out, there are some devices, there's suction, there's forceps that a physician can use to pull the infant from the mother. At this stage, they cut the umbilical cord, and the infant begins to function independently from the mother for the first time. So, this has been a long awaited moment where we can hear that first cry, and the infant is separated from the mother for the first time. So, kind of an emotional time for the mother. The third process is stage three. This is typically only a few minutes, and this is when the placenta is delivered. So, the complications that may arise during a birth, I will say the majority of births have no complications. Only about 5% need medical intervention. And in these, typically what's going to happen is what we call that C-section. So that's where they make an incision in the abdomen, and the infant is removed from the mother instead of her pushing it out through the delivery process. Once the infant is born, they will give the mother a little time to cuddle and hold, but then they will do what they call an APGAR assessment. So the APGAR assessment is typically performed at 1 minute after birth and 5 minutes after birth. And what happens is the physician will give the infant a score between 0 to 2 in 5 different categories. And these categories are appearance. So they're looking at the skin color, the pulse, the grimace reflex, the activity or the muscle tone, and the respiration or the breathing that is occurring. So this chart shows you a little bit how the APGAR scoring works. So you can see on this end are the zeros. So that's of course what we do not want. And the twos over here, those are like perfect scores. That's what we do want. And then over here, if they get a 7 to 10, that's a normal infant. If it's 4 to 6, then the infant is moderately depressed, and a 0 to 3, they need immediate attention. So that's kind of how the APGAR is used to address immediate infant health. Postpartum depression, this is something that can occur after childbirth. There is a gush of emotions and hormones that a mother is experiencing. So it is very common for mothers to experience postpartum depression. There's the baby blues, which these are, typical like mood swings and weepiness, maybe a little anxiety, difficulty sleeping. I know I used to have bad dreams about forgetting I had a baby and leaving them somewhere. Those are our normal parts of this postpartum period, right? We typically call those baby blues, but it may be more severe, or it may persist for a longer period of time. And that's when we really call it postpartum depression. A physician needs to be consulted for treatment. And about 10 to 15% of women will experience postpartum depression. So if you're a home visitor, or if you're working in an early childhood program and you're working with a mother who just had an infant, it's important to let them know that, it's okay. This is normal. We can go see the doctor and they can help you with the symptoms that come from postpartum depression. So that's definitely something we want to get help soon, because during this period, it's so important for this mother to be bonding with this infant. And postpartum depression can get in the way of that. So we definitely want them to seek treatment as soon as possible. Okay, so this was the final lecture video in this series for this week. I hope you learned a lot about promoting healthy pregnancy, the fetal development that occurs during pregnancy, as well as the labor and delivery process. If you have any questions remaining after watching these, you can consult your book, you can do some research online, or you can please reach out to me. Hope you have a great week.